If you're a doctor who has a fairly good patient flow, that's important. Having enough patients to market to is certainly critical. If you're a doctor who has 600 active patients, you're not going to be a particularly good candidate. If you have over 1,000 patients, active patients, that starts to be more possible. Obviously, more patients is helpful. But if there are patients who are seen in a clinic environment, that's not particularly valuable, because this is all about leveraging relationships into concierge memberships. Primary care doctors, whether they be family physicians or internists, can be successful with a variety of age groups, but it tends to favor a slightly older age group. We think from 40 and up is appropriate candidates, and probably the best spaces are in the 50 to 65 range. Those are age groups of people who are interested in their health care. They're interested in their relationship. They're more involved in managing their health. And so the membership tends to shift the bell curve that you currently have of patient ages slightly to the older side, maybe 10 years more to the old side. But it is a program that appeals to some younger people because of preventive care. But you're not going to get many patients who are in their 20s. You'll start to see them begin in their 30s and then a bit more in their 40s. 40s becomes a starting point, and then it grows dramatically into the 50s and 60s. The type of doctor is somebody who has a relationship and has a personality. Strong personality does help. Interest in the care of the patient and interest in the relationship is important. The type of doctor, again, if you do a lot of procedural work, it may not necessarily be something for you. But if you're seeing people with general care needs, that works. We're currently working with some gynecologists who are pure gynecologists who do care for ongoing patient work, and also do some procedures, but a normal amount of procedures. Again, we work with gastroenterologists who are doing some procedural work, but also have ongoing care for their patients. But the core physicians would be primary care physicians who qualify.